Hi, Dr. Randolph. My name is Duncan, and I'm a pharmacy student. I reviewed patient Charlotte Elgren's profile. Her birthday is 9/27 of 1994. She was in yesterday for some HIV and sexually transmitted infection testing. Her lab results are back. The first problem discussed with the patient was the HIV risk. Her labs came back negative for HIV antibodies, and her physical exam was negative for hepatosplenomegaly, which indicates she does not currently have HIV. All labs are within normal limits except the hematocrit and the hemoglobin, which are not significantly low, and they fit within the normal limits for a transgender female, so they're okay. And this indicates that she does not currently have an HIV infection. However, her sexual history of 3 partners in the last 6 months, inconsistent condom use, and the syphilis diagnosis 6 months ago, and no previous use of PrEP places her in a high risk category. According to the guidelines for use of antiretroviral agents in adults and adolescents with HIV, to initiate PrEP, the patient must have a negative HIV antibody test result within 1 week prior to starting, which her labs showed negative for. She has no signs or symptoms of HIV infection, and her estimated creatinine clearance is 104, which is over the 30 ml per minute. And she has no contraindications to initiating treatment at this time. Since she is a transgender female, Descovy is the preferred drug for pre-exposure prophylaxis. Truvada is another option that could be used, but is not preferred because the Descovy has better distribution, which allows for lower dosing and has shown better outcomes in regards to renal damage. The HIV.gov guidelines and Lexicomp monograph also recommend treatment with 1 tablet of emtricitabine, 200 milligram, tenofovir alafenamide, 25 milligram once daily, which is the Descovy. And then ibuprofen is a class D interaction with the Descovy, which she is currently on. And since this increases the risk of the patient's acute renal failure, it's best and recommended to not use the two together if possible. The second problem discussed with the patient was the STI risk. Her labs came back negative for all but syphilis, which she was treated for 6 months ago, and her titers are dropping, which indicates treatment success. Since all of the tests came back negative and her last sexual encounter was greater than 72 hours ago, she does not qualify for post-exposure prophylaxis with the doxycycline. Some short-term goals for this patient are to initiate the PrEP to reduce the patient's risk of acquiring HIV, ensure the patient is going to be adherent to this medication, and reinforce the importance of safe sex practices. And then some long-term goals for this patient is to prevent the patient from acquiring HIV, reduce morbidity and mortality, and prevent the patient from acquiring future STIs, and as well as to maintain adherence to PrEP medication. For this patient, I recommend starting the Descovy 200 for 25 milligram tablet once daily for pre-exposure prophylaxis of HIV. I also recommend stopping the ibuprofen and considering a modification of therapy for that one. And then I also recommend that the patient uses condoms more regularly and asks future partners about regular testing to reduce the risk of acquiring STIs. This patient needs to follow up with the clinic at least every 3 months, and there is no need at the moment for a referral to another healthcare provider. At 4 weeks from initiation, the patient should be seen to confirm the HIV negative test and kind of monitor for any early side effects of the medication to reconfirm the adherence to the medication and to answer any questions that they may have. And then at a 3 month appointment, the patient should be assessed for the following: an HIV antibody and HIV-1 RNA assay. And then the patient should also be monitored for that adherence and the behavioral risk reduction and some bacterial STI screening at the 3 month appointment. And then every 12 months, the patient should be assessed for their renal function, any weight changes, and their cholesterol levels, specifically a serum creatinine, a creatinine clearance, a urine glucose, a urine protein, ASTs, LFTs, and a lipid panel. And then prior to starting the Descovy, the patient should be tested for HBV and have a lipid panel performed. This should be done at an appointment in the next couple of days so that the patient can initiate on that Descovy. Those are my recommendations. Did you have any questions for me? Thank you.